Hi, my name is Dr. Mark Baz and I'm a consultant clinical psychologist, and I work for the specialist Tier 3 Camhs service in Bolton, which is based at the Royal Bolton Hospital. My role within the Camhs service, as I said, I'm a clinical psychologist, but I'm the lead for all the clinical psychologists that work within the Tier 3 Camhs service. So that means that I have a responsibility to help organise the Camhs service and to make sure that we're delivering the right services to the right people in a really positive way. The role of a clinical psychologist is to use all the training that we have in understanding the way that people work in terms of their mind, their biology, and their social life, and pulling all that together to formulate or understand their difficulties, and then to use a mixture of behavioural methods, family work, cognitive work, which is thinking work, to try and help them change those patterns of behaving which are causing problems. And that's different from our colleagues who are psychiatrists, who will also do some of that, but also use medicines to try and change the patterns of difficulty. Camhs is often divided into 4 tiers. There is some variation across the country of how people interpret those, but normally what it's meant is that Tier 1 is regarded as universal services, so those are services that are available to everyone, often through GP surgeries, through community clinics and those sorts of places, youth centres, those sorts of locations. Tier 2 is, tends to be small clusters of people like primary mental health workers working in conjunction with school nurses and other professionals like health visitors who might be seen as work with you on a one-to-one basis and will have the opportunity to refer you to more specialist services. The more specialist services are Tier 3, where groups of professionals will work together to try and understand and help with mental health difficulties, and often in conjunction with social services or other child agencies. And Tier 4 is specialist inpatient units, which are mainly for adolescents, although there are some children's units, and they tend to be in big centres like Manchester, and they cover a wide geographical area such as Greater Manchester. We also offer services and consultation to services at Tiers 1, 2 and 3. So if you were seeing someone in the primary mental health team, which is Tier 2, or seeing a school counsellor, which is also Tier 2, if they were not able to meet all of your needs, then they might ask us to become involved. Our service, as I've said before, is a very specialist service, so because we're Tier 3 we tend to be the service that other people who you might have already met, such as counsellors and primary mental health workers and teachers, we're the people that they get help from. So we tend not to refer on to too many other people, but we can refer on to Tier 4 services, which are inpatient services if we need to. But the sorts of people who refer to us are people from Tiers 1, 2 and 3. So that is people like your GP, so your family doctor, your school nurse, your social workers, health visitors, and some practice nurses within family surgeries. So once we've got an understanding of your difficulties, what we might do is look to try and offer some help. That help might be split up into psychological therapies, which might include, say, family therapy or cognitive behaviour therapy, which is looking at how you think and how you behave and trying to make changes in those areas. There are many other therapies that we offer which we can explain as people arrive, and they're recommended to people based on the strongest evidence. So what that means that what helps most people. We also offer help with medicines, so some people who have specific problems, say maybe really severe depression or low mood, we might offer them some medicine to assist but they might be offered psychological therapy as well. We also offer a range of therapies to help parents, so that might be something that your parents might be invited to come to a parent course, which will help them understand how to look after you better and to meet other parents who are going through similar difficulties and get support through that process. Some young people, in a very small number, the difficulties they might have might be so serious that a period of time in an inpatient unit, either on a paediatric ward or an adolescent inpatient unit in Manchester, might be something that we have to arrange. And if that happens, then we support the young person and their family through that whole process, and we look at joining their care while they're in the adolescent unit or the paediatric ward, and then we put together a care plan to look after them when they come out of hospital. Okay, our service, as we've said, is called Camhs, which stands for Child and Adolescent Mental Health Service. And for many young people, the mental health bit is something that they really struggle with, because other young people will say, "Oh, you're mental, go into that service," and you know, the name has that in the title. So some people will say, "I'm not going there because it says I'm mental." So the main reason why it's called Camhs is because that's the name that's used nationally, so everybody knows it by that certain name, and that means that everybody knows what they're talking about. Ideally though, we don't stigmatise young people, so that means we don't make fun of them, and we don't, you know, we offer a very friendly, comfortable service where people often feel very surprised when they arrive that it's not big locked doors and big scary places where people are talking about taking young people off to hospital and scaring them. It's a very friendly service with lots of friendly people who will help as much as they can, and the aim is to keep you at home with your family, with your friends, and to try to help you cope in the best way possible with some of the difficulties that you might be facing.